This looks like a breakthrough, but it's actually a dead end. You can now test your blood for microplastics at home, but the results won't tell you anything useful about your health. These tests can detect particles, but they can't tell you if it matters, if it's dangerous, or what the heck to do about it. Hi, I'm Dr. Niraj Patel, and this is a perfect example of something that feels like precision medicine, but breaks the moment you ask one question. What do I do with this? This is the promise. Hidden exposure, invisible risk, finally measurable. Microplastics are everywhere. Food, water, air. Studies suggest they show up in blood, in your organs, even in your brain tissue. So the logic feels clean. If it's in me, I should measure it. And that's where the entire model starts to fall apart. These kits use real lab techniques. They can detect small plastic particles. They can estimate size and the type, and yes, you'll almost certainly test positive. And it's not because something's wrong, but because exposure is universal. Some studies show up to 100% of people have detectable microplastics in blood, which is terrifying. So now you have a number. But here's the problem. There's no baseline. There's no normal range. There's no disease threshold. A result of 20 particles versus 50 particles means nothing clinically. Measurement without context is just noise with a number attached. What's even worse is the results vary wildly between labs, because measuring microplastics is extremely sensitive to contamination. Air particles, lab materials, even fat molecules can mimic plastic signals. So the number you're reacting to might not even be real. Let's say a result is high. What are you going to do? There's no treatment, no protocol, no intervention tied to a number. So you're not buying a solution, you're buying awareness with no leverage. Yes, you can reduce exposure. Less bottled water, less plastic packaging, better filtration. But you didn't need a $150 test to know that. If you like seeing how these systems actually work, this is exactly what this channel does. Because this isn't really a health product. It's a business model. High curiosity topic, invisible threat, lab-backed credibility, no need for clinical validation, and it's built for repeat testing. The product isn't the result, the product is the uncertainty. Because uncertainty scales. You don't know your level. You don't know what it means. You don't know if it can be changed. So you test again. And now the real issue becomes clear. The problem is not microplastics. It's that we're trying to solve system-level exposure with individual-level measurement. It's like testing your lungs in a polluted city instead of fixing the air. So now we have measurable exposure, no interpretation, no intervention, and a growing market that sells visibility. So it feels like control. It's actually surveillance of a problem you can't individually solve. This isn't about microplastics. It's about what happens when measurement outruns meaning. See you in the next one.